Could the current protein craze be silently fueling a health crisis that no one's talking about? That is the subject of today's episode. Welcome back to Metabolic Health Solutions, where we empower health practitioners and health seekers to get to the root cause of their health challenges. I'm Dr. Ritamarie Loscalzo. I'm the founder of the Institute of Nutritional Endocrinology, and I have a very, very special guest here with me today. Meet Dr. Monisha Bhanote. She's a board certified physician, not just a board certified physician, a quintuple board certified physician. And she is fascinated with changing the system, with turning it around. So the future of medicine is very different than what it is today, where people are empowered to get to the root causes. She's not talking health fluff, she's talking really immense changes that can help to turn around the whole landscape of what a person is living and the landscape of medicine. So, welcome to be here.
Thank you so much. Thank you so much for having me in your home.
And I'm excited that you're here because we haven't met in person before today. We've met online and we've been in the same circles. And it was super exciting when I heard she was in town this weekend. And I said, come on over, let's do this in person. So I'm really fascinated with the work that you're doing, right? As a quintuple board certified physician. So tell us a little bit about what those 5 board certifications are and how,
Yeah.
most people have 1 certification, maybe 2. You have 5. What fueled that? And how does that fuel what you're currently doing?
Yeah. So, yes, 5 is a lot. That's a lot of studying. Most of my lifetime has been studying and then a little bit of work here and there. I come from a family where it was like I got the choice, very long ago. I can be a doctor, a lawyer, or an engineer. So I was, my dad's an engineer. So I'm like, I'm not going to do that. No fun.
Yeah.
So I was actually pre-med and pre-law when I was in undergrad.
Oh, geez.
Yeah, and
Overachiever.
overachiever. Yeah, there's an overachiever in all of us. But then when I was in college, I was like, gosh, this law stuff is a lot of reading, and there's no pictures. There's
Mhm.
absolutely no pictures, right?
Mm.
Whereas pre-med, at least we got some colorful pictures to look at because we could do something
Too
else.
colorful,
Yeah,
but yeah.
but we can do something a little bit more. And I'm like, all right, fine. I still ended up double majoring and went to medical school with the idea that I was going to treat patients. I went, finished medical school, trained, and got into a residency in internal medicine. And I'm doing my residency in New York, and I'm seeing patient after patient, whether that's in the emergency room, on the floors, in the ICU, in the clinic, all these places I'm seeing patients. And I'm like, okay, I'm doing the right thing. I'm giving them the diagnosis, I'm giving them the medication that I studied so hard to remember all the mechanisms of action and pharmacology and all this stuff. And I'm like, "But they're not getting better.
Better.
So what is wrong here?" Or they get better and then they wouldn't, then they'd have side effects and, like, just, overall, like, the results weren't where they needed to be or what I felt medicine could truly be.
Right.
And so then I'm like, "All right, I gotta get to the bottom of this. I gotta see what's really going on with disease." And, so I then, went from internal medicine program into a pathology program. And most people, yeah, when they think of pathology, they think, oh, autopsies and all that stuff. Yes, there's some autopsies, but that's not what pathologists do on a daily basis. So I studied 3 types of pathology: anatomic pathology, clinical pathology, and cytopathology. So that is 3 of my board
Wow.
certifications. And anatomic pathology is basically any tissue that gets taken out of the body. And this is really important to recognize because I have had surgeons, clinicians who are doing procedures call me and ask me, is this benign or malignant? And I'm like, if you're removing something from somebody's body, you better have a clue of what's going to come back on a report. And I mean, this happens even with like colonoscopies or cervical biopsies. And I'm like, nobody's learned pathology. They've learned, okay, the diagnosis and here's the treatment, but they haven't learned actually what's going on. Right. In fact, most people skip over pathology. They're like, okay, let me just get past that. So early years of med school, I just need to get to how to treat people. So I was doing anatomic pathology and, anything from a small biopsy all the way up to organectomies, right? So now we're removing kidneys and looking at kidney tumors. We're removing lobes of lung and looking at lung tumors. We're removing colon resections and mastectomies and all these different things. And I'm going, okay, so there's a clear division between healthy tissue
Mhm.
and disease
Disease
tissue.
tissue.
And, obviously I'm seeing it on the microscopic level, but I'm also seeing the changes that are happening. So it's not
Mhm.
like, oh, it goes from healthy to poorly differentiated adenocarcinoma. No, there's a process that's
Yeah.
happening there. And I'm like, okay, there's more to this. Then, in addition, at that same time, I was studying clinical pathology, which is all your blood work stuff.
Mhm.
So looking at peripheral smears, looking at blood banks. So anytime you have a surgery or have a trauma, we need blood. So transfusion reactions, making sure that people are getting the right kind of blood for them.
Right.
And then one of the fellowships I did was in cytopathology, which cytopathology is looking at single cells under the microscope to see what are the cytologic abnormalities and changes. And this is enough to make a diagnosis of a certain disease.
Mhm.
And I know you as an endocrinologist, so you probably think about thyroid disease. And when I'm thinking about thyroid disease, I'm going, all right, so if I stick a little needle in somebody's neck with ultrasound guided and I'm going for after a nodule, is this nodule going to be nodular goiter? Is this
Mhm.
nodule going to be Hashimoto's? Is this nodule going to be a papillary thyroid carcinoma? Is this nodule going to be a follicular carcinoma? Like, what is this going to be? Because there's all different
Right.
morphologic changes happening here. And that's what cytopathology is. Not just the thyroid. We were
Right.
diagnosing everything, core needle biopsies from like liver lesions, lung lesions, anything that, could be taken
Mhm.
out.
Could be. And I want to ask you something about that though. With thyroid, so many people just get, oh, you have thyroid cancer, or
Mm.
oh, you just have cysts, and you probably have autoimmune. Is that the standard of when somebody gets a biopsy of their thyroid? Is that the standard of what the pathologist is looking for, or is that you're going more deep with that?
No, we're definitely going more deep with that. When a nodule is biopsied, we are looking at the cytologic changes because for each of these diseases, there's specific changes that's going to happen.
Mhm.
We now have, and we didn't have this early on in my training, but now we have Bethesda criteria, which helps us put
Mhm.
this category of a benign follicular nodule to an atypia of undetermined significance to then a follicular carcinoma to a papillary thyroid carcinoma. And we now have this criteria that can help us because that will also help the clinician guide the next steps. Is this
Yeah.
needs to come out? Is this a surgery? Is this just a watch and wait? Or, or if it's benign? Is it a Hashimoto's benign or is it, a hyperplastic nodule? What exactly is going on here? And we can also now do some molecular tests on these samples, which is
Mhm.
pretty cool, right? Because we're looking for certain mutations that are associated with certain cancers,
Right.
especially in
Right.
the atypias of undetermined significance, because sometimes those are a little bit more challenging. The features are super subtle. We're looking at
Mhm.
nuclear irregularities. We're looking at cytoplasm. We're looking at if they're making follicles. What are they doing? Nevertheless,
But is the patient hearing this? So they're just
oh
going, "Oh, you have
gosh,
a
no.
thyroid nodule."
Gosh, no. I actually ran into a patient recently at a conference and you know, she's coming to me, she has breast cancer. And I'm like, "Okay, so tell me what kind of breast cancer do you have?" And she's like, "Oh, it's ER positive, HER2 negative." And I'm like, okay. But what kind of breast cancer do you have? Because what they know is what their oncologist is telling them because their oncologist is focused on the actual treatment. What is a drug I can give you? If you're
Okay.
estrogen positive, I can give you a hormone blocker. If you're HER2 positive, I'll give you like Herceptin or something, right? And but there's 30 different types of breast cancer.
Mhm.
So nobody is really talking or understanding about what kind of disease you have. And then if we put everybody in the category of, oh, we're all going to have the same treatment based off of NCCN guidelines, like, okay, it's this size, which requires this surgery, which requires this kind of chemotherapy or this type of
Mhm.
radiation, and then this many years of a hormone blocker. But everybody's different.
Yeah.
Right? And, this individual didn't even know the type that she had. And when I said to her, I'm like, "Well, I've seen your report. This is what you—" She's like, "I've never heard that. This is the first time I'm hearing this." And I'm like, "Yeah, because nobody's reading your report. Or maybe you don't understand it and your clinician is not talking to you about it because he's just treating you as, oh, you have breast cancer." But nevertheless,
Yeah. And the reason I ask is
Yeah.
because there's so much information
Yeah.
right now.
Yeah.
And the patients that I see always want to know more, want to
Yeah.
know more, want to research it,
Yeah.
right? And if the person was actually told what kind of cancer, what the cells were like,
Mhm.
they could better decide
Mhm.
on the treatment.
Mhm.
They wouldn't be, because there's a lot of them who are like, I'm not doing conventional treatment.
Yeah.
I want to do alternative treatment,
Yeah.
right?
Oh, absolutely.
And there's some who say, oh, just do the conventional. But if they know, right? And if they're given that description,
Yeah.
they may make better choices.
They may. And, I had a lot of patients come to me and I'm like, I want all your pathology reports because I want to know exactly what type of tumor you have. Because if you come to me and you're like, let's just continue with the breast example. If you come to me and I see your report says an invasive tubular carcinoma and it's small, 5 millimeters and stuff. And tubulars are very on the lower end of malignancy for breast cancer. And maybe the person's like, well, I'll get it out, but I won't do chemo and I won't do hormone therapy or whatever. They wouldn't give chemo for that. I won't do hormone therapy, but I'll get it out. Well, I'll be like, okay, that's fine. That's not too bad of a choice. Now, if somebody comes to me and they have an invasive ductal carcinoma micropapillary type, which I know goes into lymph nodes and is super sneaky
Mhm.
because it's got this like retraction artifact and it has all this stuff that I've seen with so many hundreds of thousands of specimens. I should mention I also have a breast bone and soft tissue fellowship. So, I've been doing this a long time.
So that makes 6.
Well, no, 5 medical board
5 medical.
certifications, 3 fellowships.
Okay, got it.
You could kind of turn
Well,
actually one of them into 4 fellowships because I doubled down and did breast fellowship and bone and soft tissue fellowship at the same time.
so in other words, you just like to learn and you like to dig and you want to collect degrees.
No, no, no.
Help
All these certificates are sitting in a garage that doesn't
Huh.
matter to me, right?
Right.
It's
But it's
really
the knowledge,
it's the
right?
mystery of the human
Yeah.
body that I know is modifiable, right? Like
Right.
there's changes we can have, right? So we go from the microscopic to the modifiable and microscopic to metabolic to modifiable. And that's, a very important thing about reinventing healthcare, right? Like
Right.
seeing like what else is it that we can do. But, depending on the diagnosis, I would be like, "Oh gosh, that one really scares me. I know like
Mhm.
what I've
It's
seen and
aggressive.
it's
It's not
more
going to
aggressive. It
respond as
shows up.
well.
It won't disappear on green juice, like we need to have a
Right.
serious conversation about this." But these conversations aren't readily happening because what I'm seeing is we go from these extremes of, "Oh no, I'm not doing this. I don't want chemo. I don't want my hair to fall. I don't want to read. I don't want all this stuff. So I'm just going to go do this alternative, which may or may not work."
Right.
And that's the scary part,
Right.
right? Um, so nevertheless, I'm doing all of this in the pathology, and I was doing this for quite a bit of time, and I'm like sitting in a room,
Looking at
almost
sides on the
well,
microscope.
looking at slides, but then also every we have tumor boards, and in the smaller community hospitals, maybe once a week. I worked in a few bigger centers, the cancer centers, where we were doing a tumor board literally every day, and it would be a room full of a pathologist, a oncologist, a radiologist,
Mhm.
a surgeon, and we're going over the cases of the week. Like, okay, here's this person, they have this diagnosis, this is what the surgeon's going to do. This is what the oncologist is going to treat with. This is what radiation is going to do, and all
Mhm.
this. And I'm going, gosh, okay, this is great. But then we're seeing these people come back with maybe a different tumor, with maybe a recurrence, with maybe a few months later to a decade later. So what we're missing is what's going on in the body, right? The underlying ecosystem. Like, what is this imbalance that is allowing people to create this disease? And if they knew, would they change it? That's the other part. Because I know, like, it's kind of funny. One of the hospitals I worked at, won't name it, but it's a big cancer center. And I remember seeing on the news that Chick-fil-A donated all these chicken sandwiches to the breast cancer ward. And I'm going, and this is the news you want to talk about? Like, first of all, inflammation, inflammation, inflammation. PIP, IGF, inflammation. I'm like, in my head, I'm going, oh God,
Yeah.
okay, where do
Yeah,
I
yeah,
start
yeah.
with this? Right.
Yeah.
So that's where I think I went and I'm like, all right, if anybody's going to talk about this, it's going to be, there's not many pathologists who kind of leave behind their desk, because frankly, it's a great job. I mean, being a pathologist is an amazing, amazing job. You never get bored learning.
Yeah.
It's, there's always something to do. You're a doctor's doctor. So you're dealing more high level. Um, but then I was like, oh God, I can't like sit with this in the sense of like when I feel like I can help people, I need to
Right.
tell them, you know?
Right.
And so then I went and trained in integrative medicine at the Andrew Weil Center for Integrative Medicine, which is a 2.5 year fellowship. And I did get boarded in that. And then I trained in culinary medicine, really using food as medicine,
Yeah.
which now brings me to the current place of being an integrative pathologist, where I'm really taking this microscopic, metabolic, modifiable approach to the human body.
Wow.
Yeah.
Wow. Long.
Log. Oh, well, yeah, I'm
I
not even done.
And you're not even done
I'm
because
not
we'll
even.
find something else you need to dig into. So
Yeah.
I want to step into this modifiable. And there's a lot of talk about inflammation and how certain foods cause inflammation, other foods don't. But I really want to wind this around. And from your standpoint, as a pathologist and knowing the cellular and knowing the biochemistry,
Mhm.
like where this craze about protein,
Mhm.
right?
Mhm.
And you told me some scary things before we got started. I was already at the, oh my God, this protein craze is dangerous. But tell me more about like what are those hidden dangers
Yeah.
that are in this protein craze? Like get, 2 grams of protein for every pound of body weight or,
Mhm.
that kind of stuff, which is like beyond, right? How many steaks do you have to eat to get that? So,
Well, you don't need to eat steaks to get that, but there's definitely a protein craze going on right now. And, rightfully so, in a sense of as we age, like our body doesn't utilize protein
right.
as effectively. So we do need to increase our protein. And the current guidelines are more of a guideline that was set a long time ago. So you don't get protein deficient. Nobody's protein deficient. Okay. So that zero point 0.8 mark is just so you are at least getting that. But what I'm finding is that certain individuals, so people over 65 years of age, athletes, people with chronic illnesses can really benefit from having a range of their protein being from 1.2 to about 1.8, topping it at 2, because there's not greater
Grams per kilogram,
kilograms.
right? Which is
Yeah.
divide that
Yeah.
by
Yeah. So 150-pound person, divide that by 2.2 for their weight in pounds, times that by 1.2 or 1.8,
right,
so you're kind of,
depending.
you're kind of getting in there. But there's no significant benefit to going over that 2 pounds.
Mhm.
No,
2
2
grams.
points, 2 points. So what we're seeing is that the type of protein you eat also matters.
Right.
Right? So it's not just like, okay, I think we can all agree, yeah, let's eat a little bit more protein, not like I usually say 20 to 30 grams per meal. Like if you actually eat more than that in a meal and then you're like, oh, I'm only eating one meal a day and trying to, your body's going to have a hard time with it.
Yeah.
So with that, what happens is that there, depending on what kind of protein you're eating, and not everyone can afford grass-fed, clean, hormone-free. That's not what most people are eating.
No.
They're not. Maybe the few celebrity influencers are like, "Oh, this is that's not the normal diet of when people are eating protein. Grilled chicken is a big one that, I know a lot of women will do grilled chicken and broccoli. I'm losing weight. I'm going to focus on the grilled chicken and broccoli. And basically lunch is a grilled chicken breast and dinner is a grilled chicken breast and all this. And what they don't realize is that grilled chicken has a compound in it. It's like called PIP or something. And research has shown that that compound can actually make breast cancer more metastatic.
Whoa.
Yes. Yes.
Okay.
Now, 1 in 8 women already have breast cancer, right? So
Yeah.
now
And then they're
it's a
probably
problem.
having
Yeah.
a glass of wine with their
Oh, goodness. Yeah. Let's not even get
and
to
that
the
increases
alcohol.
it even
Yeah.
more,
That
right?
increases it even.
Yeah.
But there's other things that are going on. So much of the meat that's being eaten is either grilled, it's fried, or it's roasted, and it creates these compounds, these chemical compounds called AGEs, advanced glycation end products. Okay.
Right.
And AGEs are exactly what they sound like. They are
Mhm.
aging you
Yeah.
and they cause inflammation in the body. Ages will actually activate a pathway creating inflammation in the body. Okay, specific compounds that
Mhm.
it does. When that inflammation is created, that also creates DNA instability.
Mm.
Okay, so DNA instability is happening. Mitochondrial dysfunction from animal protein does happen. Advanced glycation end products is one problem that we see. Now, if you're barbecuing, say, a bell pepper or an eggplant or something like that on the barbecue grill, that doesn't happen because those proteins are different. Okay. So this is only in animal proteins when it's barbecued, fried, and all that kind of stuff. You won't get it if you put vegetables on the grill
And what is the reason that you do
because of the inherent proteins in there that
it's a
convert and
specific
when they're heated.
conversions
Yeah.
when heated?
When heated, they convert into these products.
Okay. You also get them, or is this something different, with frying or dry heat to starch? So fried potatoes.
I haven't seen it with that. I do know that I see ages a lot, and I had one patient that used a lot of Parmesan cheese and
Hmm.
put Parmesan cheese on everything, like an entire like lot. And his inflammatory markers were so high. The only thing we took out was the Parmesan cheese, and his C-reactive protein came back to normal. And like
Wow.
and so because that's another one, that bacon, all these kinds of foods. So ages is one problem. The second problem is TMAO.
Yes.
Okay. So too much TMAO, which is also another compound that gets created from having red meat or processed meats, can create cardiovascular problems in the body.
Right. Right.
Right. And
It's one of the
cardiovascular.
markers that we
Yep.
look at for cardiovascular.
Yes.
Yeah.
Yes.
And then the TMAO is produced in the gut,
Mm-hmm.
right? And it's by certain organisms that are living in the gut,
Yes.
and they produce this TMAO,
Yeah.
which is cardio
Yeah.
damaging.
Yeah. And not only that, the other one that gets produced with a high ultra processed diet, high meat diet, alcohol, sugar diet, standard, let me just say standard American diet, is beta glucuronidase, which beta glucuronidase is another enzyme that is produced by the gut bacteria, which what that one does is when it's in okay amounts, it does what it's supposed to do. It helps break down the estrogen so the estrogen leaves the body, and that's fine.
Right.
When it's in excess due to the bacteria that create it and make
Right.
excess of it, instead of taking the deconjugated estrogen out of the body, it actually reactivates that estrogen and brings it back up into circulation, which increases your risk of prostate cancer, breast cancer, and colon cancer. And beta glucuronidase is something that we can measure.
And you can
Right.
measure it. Right. You can do
Right.
a
So,
stool test.
yes, absolutely.
Yeah.
So that is one. So I gave you ages, I gave you TMAO, beta glucuronidase. The other one, so this is an interesting one. So mTOR. mTOR is a pathway that gets activated, and a lot of people are talking about mTOR
Yeah.
for aging and longevity and all this kind of
Mhm.
stuff, right? But when we eat a lot of meat, it actually gets activated. When it gets overactivated, it's going to prevent your body from having autophagy and prevent your body from cleaning itself, right? So now imagine, I'm thinking about my biohacker friends here, some of them, right? I'm doing intermittent fasting over here, but then when I eat, I'm going to eat this like 100 grams of protein, right? So the fast you just tried to do to get into autophagy, and then you messed it up with like,
much
yes,
protein.
because now you've activated this mTOR with this excess protein here. So it's
Okay.
it's a interesting biochemical pathway that's happening.
And so autophagy,
Mhm.
just a reminder for everybody, it's basically cells gobbling up. So we have all these damaged cells and the body gobbles them up and eats them for lunch, right? It's a good process. It's a cleansing process. And usually we get into that after, maybe 16 to 24 hours of fasting,
Mhm.
right? And there's differences in depending on the person and all that. And so that's a positive thing. So if mTOR is processing, and actually autophagy happens all the time, but
Yeah.
that maximum
Yeah.
autophagy, right, that you get from fasting. So if we're interrupting autophagy
Mhm.
with too much protein, what's the implications of that?
Well, so that excess protein, like one of the ways is activating this mTOR and it's really disrupting your metabolic pathways. So when metabolic pathways are disrupted, it increases the risk of insulin resistance, which is another problem we're starting to see now. And
We're starting to see.
yeah,
And
no,
it's a
we
full-blown
that's
epidemic.
full-blown.
It's a full-blown epidemic. 93% of the population
There
is
you go.
pre-insulin resistant
Yeah.
or insulin resistant.
And then we're also increasing our cancer risk, right?
Yes.
Which, nowadays cancer is like it's not even like, oh, I heard the C word. It's like everybody knows somebody who had cancer, right?
Yeah.
And we have seen there's been research done on early onset colorectal cancers. Okay.
Mhm.
So early onset colorectal cancer. So these are young people. Colon cancer used to be a disease of the elderly. It's not anymore. We're seeing it in people in their 30s and 40s and stuff like that. And early onset colorectal cancer is influenced by the gut microbiome. So now the food you eat will change your microbiome.
Absolutely.
So when you are eating a high protein, low fiber diet, okay, you don't have the very nice healthy gut lining with the mucin layer and all that, and you might have some hyperpermeability, and now these toxins are entering and then going through the bloodstream and causing inflammation and releasing more cytokines. When you have a high fiber diet and predominantly, whole foods, plant-based, eating real food,
Right.
you will then create a nice mucin layer that blocks these pathogenic organisms, pesticides, toxins, whatever, from entering the body and going and circulating elsewhere. I was just talking to another patient at well, this was an individual at the conference that I was just at, and young in his 30s,
Mm.
and he had colon cancer.
Mm.
He had rectosigmoid cancer, right? And he's telling me his story, and I'm like, so tell me, what was your life like before this? And he's like, Mountain Dew, diet soda, Doritos, the whole processed diet that
Right. That
we just
large
think it's food.
percentage.
Yeah.
Yeah.
That people are eating. So he found out about this cancer, and then he actually thought he was going to heal it holistically,
Mm.
in a sense, like, okay, I'm not going to get surgery or whatnot. But now rectosigmoid cancers, the way they grow in an apple core lesion, meaning like they kind of like just start compressing and pressing. So now you're eating, but you can't get your bowel movement through because there's no
Yeah.
space
It's
for it
space.
to kind of go through. So it got to a point where it was like, okay, the holistic treatments aren't working, and he needed surgery to get it out. And he did, and he's fine and everything. But he then went from eating the standard American diet, all this ultra processed, chemical laden food,
Mhm.
to eating a quote vegan diet, but he was not the healthy vegan.
Okay.
He was like, oh, so I basically went from Doritos and now I'm eating, what did he tell me? He goes, I'm eating veggie straws.
Oh.
And I'm like, okay. But then he learned.
Then you are.
Then he learned. But this is kind of the thing, is like what we understand as a healthy diet. And I promise you, all my patients tell me, oh, I'm eating such a healthy diet.
Oh, everybody says
Everybody says they're eating a
everybody
healthy diet.
says that.
And I'm like, why don't we let your gut microbiome tell me if you're eating a healthy diet?
Yeah.
Right. And I'm
Yeah.
like, let's just let the test tell us. And even my I have a lot of vegan patients, and they're like, I'm eating a healthy diet. I'm like, okay, let's
Let's just look
see.
at it.
Let's
Yeah.
look
Let's
at it.
evaluate it.
It's not
Right.
judgment or anything. So it is interesting because I think our relationship with food and these fads of like, we do everything in like decades, right? So there was a decade of no carbs, and like, there was a decade of no fat. Now that it's a decade of all the protein, right? So we tend to do this because we don't learn the foundations of how the human body works. Because guess what? Nobody studied pathology. It comes back to, how does disease
And
develop?
nobody's studying, at that level,
Yes.
in the university and the
Yes.
medical school
Oh,
level.
no.
Nobody's studying the effect of food
Yeah.
on the body, on the cells,
No.
on
Well,
the
that's where
organs, on
culinary
the
medicine
tissue.
comes in,
Yeah.
right? So
Right?
really using food as medicine, and looking at the diets that like change things, like, so we have a mind diet for people with cognitive stuff. We have a DASH diet for people with kidney or high blood
High blood
pressure, right?
Yeah.
But at the end of the day, most of the diets, what they have in common is they're not ultra processed diets.
Right.
They're not extreme where you're eating far ends of like, let me just eat protein and like remove all the fiber, which at the end of the day, our gut microbiome needs.
Needs.
Like
Absolutely.
you're literally eliminating something that could help you. Not many people, at least in the cancer world, even think about or look at the gut microbiome as a treatment mechanism. And we know, like, there's great research on this now, that people who do go through conventional therapy and say they're doing immunotherapy or something like that,
Right.
if their gut microbiome has healthy bacteria in it, it can actually make the treatment more efficacious.
Makes sense.
There
Right?
you go,
Makes
right?
sense.
Yeah,
Right?
because it helps it along, right?
Yeah. Yeah. It makes total sense. So one of the things that surprised me is when we were having our conversation earlier was that you said that the large amounts of protein can have a negative impact on the nervous system and the brain.
Mhm.
And that's something people aren't aware of, or they wouldn't be pushing so much protein. So tell us
Yeah.
the downside of too much protein, and where does that sit? Like, is it having 200 grams of protein a day? Is it at twice your body? So where does it sit in terms of the amount, or is it personalized per person?
Well, one, it is personalized per person, but I would say if you were to calculate it, I would put it at that 2.0 mark,
2 grams
two,
per 2 kilo.
kilograms. Yeah, 2 per kilogram of body weight, same weight calculation.
Okay,
Right?
let's
You
get
want to
that.
calculate it? All right,
Yes,
so let's calculate it.
let's calculate that.
Okay,
So
so
if somebody weighs, let's say they're 175 pounds,
175-pound male. So I'm going to divide that by 2.2
yes,
to get their weight. So that's 79.5.
yep,
Okay.
kilo, yeah.
Kilo. No, pounds, 79.5.
Well, the other was pounds, so this is kilo.
Oh, yeah, this is kilo now, right? So I'm going to times the kilo by 2.
By
So
2.
now times 2. So now if this person is eating 159 grams of protein, they are eating way too
Way
much,
too much.
right? So
Okay.
here's
And
the
that's
thing.
common. We're seeing it all the
Oh,
time
gosh, yeah.
on these YouTube videos, and the people are recommending 150 to 200. I saw somebody recommending for a woman
Yeah.
150 grams of protein
Yeah.
a day. And that wasn't even an athletic woman,
Yeah.
bodybuilder. It was more, the average
Just average human.
human,
Yeah.
right? So the average, let's say 65 and up woman
Mhm.
who's concerned about her bones, who and they all are, right? We're all like postmenopausal, everybody's concerned about their bones, and is kind of moderately doing kind of following the standards of guidelines, which is, walking 20, 30 minutes 3, 4 times a week.
Gosh, that's not enough.
No, it's nowhere near enough, right? But that average person. So let's just say she's walking 45 minutes 6 times a week,
Okay.
right? And she's concerned about her bones,
Mhm.
but she's not doing any heavy lifting, which for most women in that age range, they're not. Where would you put their protein needs? And they're not sick. They don't have, their bodies covered with burns or anything, but
I would put them down to like 1.2.
1.2.
1.2, yeah.
Yeah.
Yeah. If they're not very active, they're pretty sedentary, like, they're just walking as their activity. I would put them closer to the 1.2, but also personalized too, because here's the other thing is I'm finding that sometimes when people get older, they're also not eating as much food.
Yeah.
And we need food. Like I don't want people to be afraid of food, but you also need fiber. And here's the problem with too much
Right.
animal protein is you don't have fiber in
The
it.
fiber with
You don't have
right.
fiber, right? So cheese, which us women love, right? So dairy, meat, and sugar have no fiber.
Right.
All right. So
Eggs, probably little or no.
I don't know if eggs
I
have
don't
fiber.
think
Yeah,
egg
I don't think
whites
eggs
have
have
fiber
fiber.
either.
I don't think they have fiber. Correct me if I'm wrong. I might. But when I think about it, and I think about, all right, somebody having, a bagel or sandwich or pastry for breakfast, and then for lunch, maybe they're having, a Caesar salad with grilled chicken on it, and then for dinner, maybe they're having. Okay, so I got the sugar. And then maybe they're having some cheese with a glass of wine. And I'm just thinking about this whole cascade, this metabolic
Right.
cascade that's
Right.
happening, this inflammatory
Yeah.
process. And not only is the inflammatory process changing your gut microbiome, which many people don't think about from the gut microbiome, that your immune system lives there, right?
Right. Right.
70% of our immune system is in the gut.
In the gut.
Why are we developing autoimmune diseases? Because our gut is not healthy,
Right.
right? Not even that, if we think about just what somebody is doing on a regular basis, eating out, we can have a whole conversation about oil separately, but like just the
No.
constant flood of I like to think of food as molecular code.
Yeah.
Okay,
It's
right?
information for
Yes,
the
it's
cell.
information for
Yep.
your cells, right? So it's your choice what kind of molecular code like you want to give it. You can give it the kind that's going to keep you healthy and strong, or you can give it the one that's going to create disease.
Right.
And from that inflammation perspective, one of the last things we didn't talk about was nitrosamines, right? So I travel a lot, so airports are very fascinating to me because it's like, what are you going to eat at an airport?
Mm-mm.
Well, me, very little.
Yeah, right.
But just sitting and watching people having these meals and what they're eating day in, day out, and I'm like, heart attack, inflammation, arthritis, like, it's like
Right.
I can
You
see
can
it, right?
see. Yeah.
And once you see it, you can't really turn back, you know? Many of the places will have deli sandwiches,
Yeah.
right? So like, there's all different.
And pastrami.
Yeah, just like
Yeah.
sandwiches, and different kinds of things. But what many people don't realize is that that processed meat has nitrosamines in it, right?
Yeah.
And these compounds, well, frankly, they cross the blood-brain barrier. Okay, so now if they're crossing from the into the blood-brain barrier and going to the brain, they can actually damage your neurons because they damage DNA
Mm.
cells. And neurons, brain cells are very sensitive, right?
Yeah.
So now you're damaging your neurons and your brain cells, and it could also promote the deposition of amyloid.
No.
Right. So now people who are eating this kind of diet and we're seeing so much dementia,
So
it's
much.
vascular dementia, like we're seeing a lot of dementias in people. Part of it's your diet.
Yep.
And,
A big
people are,
part.
huh?
A
A
big part.
significant part.
Right.
So this is where that modifiable part comes in, is that you have to understand what you do every day, like your lifestyle, your 24 hours of a day, the choices you make is all a signal to your cells and what they are going to do
Right.
for you.
Exactly.
You can't ignore it.
You can't.
Like you can ignore it maybe in your 20s, but I promise you it's going to catch
Yeah,
up
but
with you.
even in your 20s, it's going to catch up
Oh, it'll
with you.
catch
It's
up. Well,
setting the
now
stage for
nowadays
the
it
diseases
is.
that we
It's the
see
stage.
later, right?
It is. It is.
Yeah.
Yeah, you'd actually don't want to ignore it ever, but
No.
um
But you get away with it in the fact that you don't necessarily show the symptoms.
so this comes up to the lab test, right? So when we think about lab tests and like, oh, I went to my doctor said my labs were fine, see you next year, blah blah blah. Those lab tests, as a person who's been a laboratory medical director who has validated this testing where we give that reference range and everything, that reference range is really just meant as a baseline. It's not meant for health per se.
Mhm.
It's meant to identify, all right, do we have a disease process that we can now give a medication for?
Yep. Yep.
Okay. And
Exactly.
this is why when people get lab tests, the conventional ones that they go and they get their annual blood work
Right.
and everything's mostly fine, it's because they don't have enough abnormalities in there to give you a drug. Now, that's going to show up when about 50 to 75% of your organs are already damaged. We don't want to wait.
We don't want to wait that
We
long.
don't wanna wait
It's
that
too
long.
hard to reverse. I mean,
Yeah.
come on.
Yes.
Really.
Yes.
Yeah. Yeah. Yeah.
So and this is the beauty of now, we have all this more in-depth testing in the integrative and functional space
Right.
where you can, if you actually understand how to interpret tests, which is
Right.
also very critical.
Which is very critical, and that's what we teach.
Yes.
That's what I teach my students.
Yes, is if you can interpret tests properly, which, like I told you, most clinicians can't because they're so used to this, like,
They use the lab, right? That's
it,
how they do it. HL,
yeah,
HL.
yeah,
Oh,
yeah,
everything's fine. Scan down.
yeah. That's not the way the
How long
human
does it
body
take you
works.
to look at a lab and
Yeah.
understand it? It takes me quite a while
Oh yeah.
because I'm looking at ratios. I'm
Yeah.
looking at ranges. I'm not going, oh, there's no L's or H's.
Yeah. Yeah.
In fact, I don't even use those ranges because I think those
Yeah, I don't
ranges are
use those
so crazy.
Yeah,
So
I don't use
I
the ranges
pop them
either.
into another program which shows this the functional ranges. But that's the point. Do we want to wait for disease and pathology to make their ugly heads known, or do we want to catch things when they're going astray?
Yeah.
And when there's no need for a drug at this point, but there is need for a lifestyle change. There is
Yeah.
need for a diet.
And I'm going to give you one of the more common examples of this, and because this is one that absolutely drives me bananas, is that reflux. Okay,
Mm.
reflux is a mechanism that's happening where the acid from your stomach is going up through your lower esophageal sphincter into your esophagus. That reflux that
Really
you
healthy.
feel.
Yeah.
So when somebody has reflux, what do they get? They get a
Acid
medication.
blockers.
They get acid blockers
Right.
because the goal is let's not make that go up.
No, the
Now,
goal is let's not make acid.
let's not make acid.
Let's make because
Yeah.
they're not changing that
Yeah.
the
Yeah, they're
still
not changing. Yeah.
reflux.
So
There's
what's
still
yeah,
reflux, but it's not acidic
it's not
anymore.
acidic, but
Right.
it's pathologic because what
Yeah.
happens is you have the stomach here and at that GE junction, and then you have the esophagus. The stomach has specific cells, okay, and has specific cells with specific functions. The esophagus has squamous line cells. When the acid, or not acid, but the fluid continues to go up, right?
Yeah.
The squamous cells that are sitting there can't handle it.
Right.
And what do? they're like, hey, I'm getting out of here, and other cells are going to take over. So metaplastic cells come in, known as goblet cells or intestinal metaplasia. Okay. And so then this person is going to get scoped and upper endoscopy every like 6 months to see like, okay, we see this process. We're seeing intestinal metaplasia, but now we got to focus on dysplasia, which dysplasia is precancerous. Okay.
Yeah.
And so they're getting scoped every 6 months. They maybe are told change your diet, but not the specifics.
They're told not to eat tomatoes.
Yeah. Or don't do coffee.
Or don't,
Yeah.
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 I mean, but
Or
basically,
chocolate.
don't
Yeah.
eat these things that are acidic
Yeah.
versus
What's really
what's
going
really going on.
So now you have this person who's on a PPI that shouldn't, first of all, be on it for more than a couple weeks, but is on it for 20 years.
Yeah.
Okay. And they keep going back in and they're like, I'm doing what I'm supposed to be doing. The medication in my head is working because that's what I was told. And this person goes from intestinal metaplasia or goblet cells to low grade dysplasia. It's like, oh gosh, now we got to keep tracking this even more because now we're at low grade dysplasia. Well, low grade dysplasia, because they haven't changed anything in their lifestyle and all they're doing is taking this medication, goes to high grade dysplasia, which eventually will turn into invasive adenocarcinoma, which then means you're getting your esophagus and your stomach taken out. You're getting that whole part of you,
Yeah.
and you will never eat the same again.
No.
Right. And then there's this whole other cascade because now you've been on PPIs for 20 years and now you have increased your risk of cardiovascular disease, kidney disease, and osteoporosis.
Right.
So now we have this whole other
And you're not
pathway.
digesting all that protein you're eating.
No.
Because we need acid in the stomach to break down the pepsin, acid.
Yes. That's my
Right.
pet peeve number one is the reflux. My second one, because I spent a lot of time in GI and gastroenterologist offices looking at their biopsies and all this other stuff, is the gallbladder. When a person gets their gallbladder removed, they are not told that they need to change their diet. Hello, you do not have bile storage anymore and you continue to eat the fat. Your body is not breaking down.
Yeah.
Any food, even if it's healthy food, if it is not broken down, will create inflammation. Okay.
Yes.
So we could go on and talk about this for an eternity because like there's just so much. But yeah. So I just want to say like lab values are something that should be interpreted by a clinician who actually understands lab values. Like don't just go with what's on the piece of paper. This is why it's very, with caution that patients now can go do their own labs, but
Yeah.
they don't understand.
They don't understand them. Right.
I mean,
So-
clinicians don't even understand them. So now you're asking a patient who can go order their own blood work and get labs like, oh, everything looks fine. No.
I think it's good that people can do it
Yeah.
because most doctors don't order the proper tests, but usually in conjunction with the education
Yeah.
and working with a clinician or a group or a program, we put together programs to help people read their own labs because I think it's great because if not, the doctor's not going to run lipoprotein little a and find out that this.
Yeah, and that has more
they're
to
not
do with
gonna-
insurance and stuff like
Yes.
that. So
Yes.
it's a little more complex than that. But at the end of the day, I think the message is, and I kind of use this terminology hashtag cell care because I really want you to focus on your cellular health.
Yeah.
So if you are experiencing any symptom, whatever it is,
Yeah.
listen to what your body is saying. Listen to your cells. Listen to that communication because it is literally communicating with you.
Yes. Yes, absolutely. Absolutely. So I want to wrap it up and wind it back to the protein thing.
Yes.
So the protein craze is there. If you are on social media at all or on YouTube at all, everybody and their brother is showing you the muscles and showing you that you need to eat. And somebody was saying a very popular influencer with hundreds of thousands, maybe even up to 1 million followers, was saying the amount of protein that a woman needs to eat is equivalent to they need to eat 20 eggs a day. So let's just discuss the danger of, first of all, 20 eggs a day. And she said it with a straight face.
Wow. The only thing I can say about that is that person does not know the inside of a human body and what actually happens when you eat that way.
Yeah.
And I don't know many people who've actually, like, I've actually had my hands inside human bodies where I can go and peel back the calcific atherosclerosis and the plaques. I can see the shrunken kidneys. I can see the atrophic brains. I mean, I know what happens. And if I didn't think things happen and I didn't believe in the power of using food as molecular code as much as I would be eating all that stuff too. But
Yeah.
I myself have changed my lifestyle because of what I've seen and what I know.
plant-based now.
I am plant-based.
How long have you been doing that?
Since 2014, so over a decade.
It's over a decade. Okay.
Yes.
And
And I remember because I'll tell you, my last meal, I like to do things on New Year's. So my last meal, December 31st, 2013, before I went plant-based, was the biggest macaroni and cheese. Of course, because we love our cheese. I'm not going to deny it, right? Was the biggest macaroni and cheese catering size from Panera that I could get because Panera was one thing as a that I used to order for our lab parties and all that stuff. So it was just like on speed dial, right?
right.
And so so I had this catering side. I'm like, gosh, this is absolutely disgusting. I can't believe this, right? And then the next day I wake up and I'm done. Cheese and dairy really concern me when it comes around to breast cancer because, like I said, I've done a breast cancer fellowship and it's really quite concerning. My youngest patient I had was 18 years old. Her genetics were
Oh, wow.
totally normal. All the mutations, all normal.
So no BRCAs.
No, 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 no,
So,
no, no.
no.
And all she wanted to do was go back to school. She's like, I just want to focus on school. I don't want to go through all of this treatment and all this kind of stuff. And I'm like, my God. But and this is a whole nother conversation outside of food, but we are living in an age where people are just exposed to so many chemicals. I mean, this was a girl who was like in Ulta in Sephora since she was like a little kid. All the beauty products, all these
Right.
different things that we are just exposed to, and our body can't handle it.
Can't handle it.
Our body does not know how to eliminate it. We don't have the tools, and one of the most powerful tools can be your diet.
Yeah. Yeah.
And so,
Yeah,
yeah.
absolutely. Wow. Okay, so you've been doing it and you've been, integrating this into your work with
Mhm.
patients. So, and I've been doing it for 40 years, by the way.
Wow. You go,
Yeah,
girl.
I reversed all my health conditions. And does this mean, like, when you have people coming in, are you insistent that they all go 100%
No.
plant-based? Is there room for some? So, let's talk about that.
Yeah. So most of the patients that come to me are not plant-based when they come
Yeah.
to me. You know,
Yeah.
they're eating the standard American diet or they're eating a, more luxurious, highly animal-based diet. So we kind of work on shifting their understanding from the cellular level of what is going on in their body with their symptoms. What are we seeing in their gut microbiome? What are we seeing in their testing from, their oxidative stress levels to other toxins maybe in the body? What are all these things that are going on? And how can we slowly shift it? Because at the end of the day, it's supposed to be a lifestyle, right?
Right.
We don't want to go into, oh, let's just go do another diet. Like, no, we're not just going into
No,
let's go
it's
go on a vegan diet and that's going to fix my problem. No, this is about how can we heal the body. And so I usually start with going from whatever they're at to more of an anti-inflammatory diet,
right.
kind
So
of
tell me more. What
Mediterranean,
are you taking out?
ultra processed food.
Right?
Yeah. Ultra processed food is a big one.
Going.
We are reducing the amount of animal
No
protein
protein.
they have. Okay. So
Okay.
instead of 3 times a day, which 3 times a day times 7 days is 21 times a week, we might go down to, depending on the individual, once a day.
Yeah.
And then eventually 1 to 2 times a week
Yeah.
is kind of the goal. But it's also not to starve yourself because we want to increase the things they're not eating. So fruits and
Right.
vegetables, they're not eating, people aren't eating them.
No.
Like, and I'm sorry, but apples and bananas is not enough. Like when I talk to people about what are you eating, like it's so
It's so
basic.
basic. Yeah.
And I'm
Lettuce,
like, gosh,
tomato,
American
apple,
Gut
banana.
Project tells us we need 30 different fruits and vegetables a week,
Yeah.
right? 30 different. And most people are eating maybe three, like not even close.
Yeah.
So we start there and everybody's on their own journey. Some people like grasp on right away
Right.
and some people take some time. But what all people who end up doing it do, or most of my patients, is because of the way we do it, they feel better.
Yeah.
And that's like the kicker is like, oh, I didn't know that I could feel good. I didn't know what having a healthy bowel movement was
Well,
because I didn't know what not feeling bloated is. So it's kind of fascinating to see like the light bulbs go off and like
yeah.
oh, I've got energy. What is this? You
Yeah.
know, like,
Yeah. Yeah. Yeah.
yeah.
Wow. Wow. So let's last thing on the protein I want to talk about is we talk about people who are doing keto
Mhm.
and carnivore,
Oh,
right?
yeah.
So carnivore is pretty extreme. They're eliminating all fiber.
Mm.
And keto, if it's a animal based, I call it dirty keto.
Okay.
If it's an animal based keto, they're eating less. They're eating some fiber, but that little piece of lettuce that's allowed on their plate and the little, you know what I mean?
It's
So some people take it to an extreme. So let's talk about the carnivore because that's the extreme. And when you talk to them, they're saying we don't need fiber. And all those phytochemicals are actually dangerous and they're plant chemicals and they're hurting us. These are the things that people who are doing carnivore are saying. And how do you compute this?
I don't think they actually understand how the human body works.
Mhm.
Because many of the individuals who I have seen who are doing this extreme, like, let me take out the fiber, let me take out the vegetables, let me take out the oxalates because the oxalates are, all this
Right.
silliness that's happening, um, are not necessarily healthy. And I think also there's a big difference between doing it for a short amount of time to kind of clean up,
Like
like
an
like
elimination.
yeah, like an elimination, right? If you're
Right.
you're going from cleaning up all the junk and processed food, and now you're going into a carnivore, yeah, you're gonna feel better because you took out all the
You took that
processed
all
food, right? Let's just
right. Or the
talk.
stuff that
Yeah,
was tearing apart.
yeah.
Yeah.
Let's just talk about it for real. But that's not gonna last because you're gonna create inflammation in the body. You're gonna create this dysbiosis or imbalance in your gut microbiome. You're going to reduce the bacteria that are beneficial for you
Mhm.
that can keep disease away. You're not going to make short chain fatty acids. Short chain fatty acids, which one of them is butyrate, is made as a postbiotic from your prebiotic food you're eating.
Right.
So,
Fiber, color,
but
color.
yeah,
Yeah.
so you're going to create inflammation, you're going to create oxidative stress, you're going to create disease. It's not
Yeah.
sustainable. It is absolutely not sustainable.
So those who say, yeah, temporary relief, they're getting rid of the ultra processed foods. They're getting rid of, and some people have a problem with oxalates because of their gut being damaged and all that.
Very rare
It's
people.
not very high. That's
No,
right.
that's
Maybe
all.
5% of the
Yeah,
population, maybe.
most people.
Lectins, the same thing. It's
Oh
over
goodness, I just wrote an
10%.
entire article about lectins because I taught a cooking class to my patients 2 weeks ago about lentils and lectins because they're so afraid of it. And I'm like, nobody's eating raw lentils. Nobody's eating raw beans.
No,
Okay, so when you cook them, the lectins actually are
they go away.
yeah.
Yeah.
So you don't
Yeah.
really need to worry.
And fermenting does that too.
Yes.
A lot of the foods
Yes.
takes away the like or significant and oxalates, same
Yeah.
thing. Okay, so we've come full circle. Let's close with people listening are health practitioners of all kinds, health coaches, nurses, doctors, naturopaths, etc. And also what I call the nerdy nutrition geeks who like to get into all this
Yeah.
cellular stuff and really understand it. Let's talk about plant protein.
Mm. Yeah.
So people are saying it's incomplete, which was debunked a long time ago, but
Yes.
the amino acid profile isn't as rigorous. Most proteins, this is what I was just researching recently, but even egg protein is only like 49% maybe bioavailable. Maybe it was 32%. It was really low bioavailability of all protein, which supposedly goes down as we age because our stomach acid goes down. Worse for people who are on PPIs.
Mm-hmm.
But tell us, like, just talk about plant protein versus animal protein. And can someone who needs to get, let's just say they do need that 1.6 times their body weight or 1.8 times their body weight, can they get that to a
Yeah,
plant-based diet and
absolutely,
how?
absolutely. Have you not seen all the plant-based athletes there are? I mean, I
I
could
know.
name quite a few.
Right.
I know I just when I walked into your house, I saw Robert Cheek's book, and if you go look at him, he's all muscle.
Yeah.
He's plant-based, right? There's quite a few if you want to be that muscular, but plant-based protein is when I'm thinking of that, I'm thinking of real foods, right? So I'm thinking of like lentils and beans and tofu. I probably eat a block of tofu every day because I
Mm.
don't have allergies to it or anything like that. And
Hemp seeds are a
hemp
good
seeds,
source
two
of protein.
tablespoons of hemp seeds, and you can get like 10 grams of protein.
Kale is a good source of protein if you eat the right
Vegetables have
amount, right? That's
protein,
the thing that people
right?
go, "Oh, those don't count." They do count.
They
I have put my recipes for green smoothies in the Carnometer and other
yeah
apps and come out with there's 30 grams of protein
yeah
in my smoothie.
yeah.
Okay.
None of us have protein deficiencies, okay? Most of us do not.
Yeah.
Most of us are getting too much protein.
Right.
Okay. So with the plant-based protein, I think it's more of we're not used to eating it in our diet because it's not part of the standard American, like that we
Mhm.
can easily get it, you know?
Right.
Like nowadays, yeah, we might see some quinoa somewhere. Nowadays, we might find some tofu, but not all places. And we also don't know if it's organic, non-GMO,
And
which
what
is
about people who are allergic, which is the
yes,
top
yeah.
allergen? So
And
we're not gonna call you
beans,
block.
lentils, you might see black beans or chickpeas here and there, but it's not a very common or prevalent thing. So you actually have to, one, learn how to prepare it,
Yeah,
right? Which many people don't cook,
yeah,
right? You need to learn how to have it consistently because sometimes what happens is people be like, oh, I ate beans and now I'm bloated,
yeah.
right? So you have to shift that microbiome slowly if you're going to do that. So that might look like just 2 tablespoons of a lentil or bean until you can
So
build
you
it
can
up.
build it
Yeah,
up, yeah.
because your microbiome will change for the better.
It will. Yeah, absolutely. And for those of you who are allergic to soy or are concerned about soy and estrogen, that's the big thing, like, stay away from soy.
No, not at all. I have all my cancer patients on tofu. So the recommendation is to have at least 1 to 2 servings of whole unprocessed soy. So that means either edamame, that
Mhm.
means organic non-GMO tofu, or soy milk, which is basically just soy milk and water, like soybeans and
Yeah.
water. Okay. And
Or
there's
tempeh.
yeah, tempeh is
Tempeh
a
or hot.
fermented
Yeah.
version, yeah. And the studies that actually show individuals who consume soy have a 30% decreased risk of breast cancer. Remember, if we circle back around
Right.
to one of the biggest problems we're having in the US is breast cancer
Yeah.
consumption. So individuals who have been consuming soy for a lifetime, like in the Asian population,
Right.
have a lower risk until they start eating the
Right.
American way, right? Even individuals after they've been diagnosed with breast cancer and they start eating soy have better outcomes.
Mm.
Okay. So there's no concern for that. There was a study that came out a long time ago where there was a lot of misinformation. Nobody's eating soy protein isolate. I mean, if
Well,
you're eating
people are, but
well,
yeah.
you shouldn't be.
You
That's not
shouldn't
the
be.
guy that I'm
Right.
saying. So,
That's not what you're
so
saying.
no soy chicken nuggets or hot dogs or all that.
Right.
I'm not
Yeah,
saying
all that
that
processed
or
soy.
that
Yeah.
processed soy. But even that, the amount that was given in that research study, nobody would consume in a lifetime.
That much. Okay. Yeah.
Yes, so I am not concerned about
Not
soy.
concerned about soy.
You should have seen the biggest block of tofu I had for lunch today. It was absolutely amazing. Fabulous.
So here's the thing. So tofu doesn't have to be made with soybeans. I've made lentil tofu. I've seen
Yeah, chickpea.
recipes for
Chickpea tofu.
chickpea. I bought fava bean
Mhm,
tofu, and I saw somebody make split pea
mhm,
tofu, and that's actually quite easy to make.
mhm.
So we can include a recipe or something in the show
Oh,
notes.
I've got
But
plenty of
yeah,
recipes.
yeah, because you don't have to eat soy, and I don't eat soy hardly ever. I mean, I eat it. My husband's allergic to it. My
Mm.
son was allergic to it. So we don't keep soy in the house, but occasionally have some tofu. But there's a lot of plant-based sources of protein, and nuts and seeds are highly overlooked.
Mm, mhm.
What are your thoughts on protein powders?
Not particularly a fan of them. I don't really use them very often because it comes back to being more processed.
Right.
Right? So
Right.
as little processed as we can get. And if I was gonna choose something processed, I would probably take a nice piece of vegan chocolate or something and have that over protein powder, just because
Yeah, but you're not going to get so much protein.
no, no, no,
It's
no.
chocolate,
Not for
but
protein, but my
right.
point is if I had to choose a processed food, uh I would pick something that I want to really
Really want to
enjoy
eat.
than do it for protein
Right.
powder. Yeah.
But for people like a woman, osteoporosis, can't eat that much, protein powder?
I possibly, but you really want to look for clean protein powders because about 75% of the ones on the market do also have a lot of heavy metal
Right,
contaminations
right.
and other contaminations, pesticides, and all that kind of stuff.
Those are mostly rice,
Yeah.
the rice protein.
So
Yeah.
just be very selective about
I have
that.
found, and I'm a fan of, if people want to do protein powders, single ingredient protein
Mm.
powders, right? There's a few. There's a fava bean, there's a mung bean, there's a chickpea, pumpkin seed, sunflower
I make
seed.
mung bean pancakes.
Ooh,
Yeah.
yum.
Yeah. See, I just like the food. So
Yeah, yeah,
you
yeah,
see,
yeah, yeah,
I
absolutely.
do a lot of lentils. I do a 4 lentil soup or dal, 4 lentil dal that I make. I make basin pancakes, which is chickpea flour pancakes with like scallions and cilantro and all the stuff
Nice.
in it. Yeah. So
Awesome. Awesome.
like
So we've gone full circle here. The last thing we'll end with is personalization. There's no one size fits all. Everybody has to choose what's the best for them, right? Not what some study showed, because there's a lot of people quoting studies and debunking studies and all this stuff. That's the latest craze on social media.
not one study, not what social media is telling you. Like, start listening to your body.
Yes,
Start listening to your body and paying attention to the cues that it's giving you, because we're listening to all this external information without
that's right.
paying attention to what's going on here.
And we're making decisions that are for a population, and you may not, there may be a great study and it's got 100,000 people and it comes out with the idea that, 75% of these did well with whatever. What about the other 25%? You may be in that other 25%. So we have to personalize it and we have to pay attention. And if you're out at the gym and you're heavy lifting and your muscles are wimpy and they're not growing, is a good chance that something's wrong. It may be that you don't have enough protein. It may be that you're not digesting protein. It also can be something else. So you have to pay attention. That's my feeling.
Yeah.
Well, phew, this is this has been a great discussion. We are talking to Dr. Monisha Bhanote, and she is the author of
The Anatomy of
The
Well-Being.
Anatomy of Well-Being, and she has come full circle. She comes with so much wisdom and so much training in pathology and cells and cancer therapies, all this stuff to put it together, a way to work with people to help them not make cancer anymore, to get them to the point where the body is working properly. And don't just listen to influencers on social media who tell you to eat 20 eggs a day. I'm sorry. There's something wrong with that. All right. So thank you, thank you, thank you. Any last parting words, and how do people find you?
I'm easy to find on social media. I'm Dr. Bhanote. So whether that's on Instagram, Facebook, YouTube, Pinterest, all the platforms. My website is drbhanote.com. And
Spell that for everybody.
yes, DRBHANOTE.
And we'll have that all in the notes.
Yes.
So
And I think I have a cookbook that I'm providing you guys. It's a cell care cookbook, which is, well, it is plant-based, gluten-free recipes, but they're easy to make because
nice.
I love cooking in under 15, 20 minutes
Yeah.
and eating my food. So, yeah,
Great.
thank you so much.
Thank you, thank you, thank you. And all of us as health practitioners in the new future, the reinvention of healthcare, we have in our power to truly change lives. Our conversation at the beginning talked about being in an internal medicine residency and seeing people weren't getting well. I'm just shocked that not more people in that situation, not more physicians are noticing that we just keep doing the same things we learned in medical school, but people aren't getting well. So we have the power to help people change it, make different choices to change their cellular biology, to change the way their body handles the environment, and to be healthy. For more information about metabolic health and insulin resistance, click on this video over here. And don't forget to like and subscribe and share this video to keep up to date on the latest in metabolic health solutions.